Ever feel bloated, sluggish, or just downright miserable after eating bread, pasta, or pizza? You're not alone. If you're constantly dealing with stomach pain, fatigue, or digestive issues after eating gluten, it could be a sign of celiac disease or gluten sensitivity. Celiac disease is an autoimmune disorder where gluten actually triggers the immune system to attack your small intestine. Gluten sensitivity, on the other hand, doesn't cause this damage, but can still lead to a range of frustrating symptoms. The problem? Many people go undiagnosed for years, leading to serious health issues like nutrient deficiencies, chronic inflammation, and more. But here's the good news. There are ways to manage it effectively. In this video, we're breaking it all down. Who's at risk, the symptoms to watch for, how doctors diagnose it, and what you can do to feel better. So if you've ever wondered whether gluten is secretly making you sick, stick around. Let's get into it. What is celiac disease and gluten sensitivity? So, what exactly is celiac disease? It's not just an upset stomach after eating gluten. It's an autoimmune disorder. When someone with celiac disease eats foods containing gluten, which is a protein found in wheat, barley, and rye, their immune system mistakenly attacks the lining of their small intestine. Over time, this damage can lead to serious health problems, including malnutrition, osteoporosis, and even neurological issues. On the other hand, we have non-celiac gluten sensitivity, or NCGS. People with gluten sensitivity experience similar digestive issues, bloating, diarrhea, brain fog, fatigue, but without the autoimmune response or long-term intestinal damage that occurs with celiac disease. That's a huge distinction. Here's the key difference. Celiac disease is a lifelong condition that requires strict 100% gluten avoidance, no exceptions. Even tiny amounts can trigger inflammation and damage the gut. Gluten sensitivity, however, is more flexible. Some people may tolerate small amounts of gluten without major issues, while others feel better eliminating it completely. The challenge? Both conditions can be tricky to diagnose because their symptoms overlap with many other digestive disorders. That's why getting the right tests and medical advice is so important, which we'll get into shortly. So, who's most at risk for developing celiac disease or gluten sensitivity? While anyone can develop these conditions, some factors make it much more likely. First up, genetics. If you have a family member with celiac disease, your risk is significantly higher. In fact, first-degree relatives like parents, siblings, or children have about a 10% chance of developing it. That's because celiac disease is linked to specific genes, particularly HLA-DQ2 and HLA-DQ8. Next, celiac disease is often connected to other autoimmune disorders. If you have type 1 diabetes, Hashimoto's thyroiditis, rheumatoid arthritis, or multiple sclerosis, your immune system is already more prone to attacking your own body. This makes you more susceptible to developing celiac disease as well. But genetics aren't the whole story. Environmental triggers can also play a role. Certain infections, severe stress, surgery, or even pregnancy may trigger the onset of celiac disease in people who are genetically predisposed. In other words, you could carry the genes for years without issues, but a major life event could switch it on. And here's something interesting. Celiac disease is more common in women than in men. Researchers believe hormonal factors and differences in immune response could play a role. Gluten sensitivity also appears to be more frequently reported by women, though the exact reasons aren't fully understood. So, if you have a family history, an autoimmune condition, or you've been dealing with unexplained digestive issues, it might be worth getting tested. Coming up next, let's talk about the symptoms, because celiac disease isn't just about stomach problems. Celiac disease and gluten sensitivity can be tricky to diagnose because their symptoms vary so much from person to person. Some people experience severe digestive issues, while others barely notice anything wrong until serious health problems develop. Let's break it down. First, let's talk about the classic digestive symptoms. If you have celiac disease or gluten sensitivity, you might experience bloating, diarrhea, constipation, nausea, or abdominal pain after eating gluten. These issues happen because gluten damages the gut lining in celiac disease, or triggers inflammation in gluten sensitivity. But symptoms aren't just limited to the gut. Many people with celiac disease struggle with fatigue, brain fog, and even joint pain. There's also a skin condition called dermatitis herpetiformis, which causes itchy, blistering rashes, often on the elbows, knees, or scalp. If you've been dealing with mysterious rashes that don't seem to go away, gluten could be the culprit. Another major issue? Nutritional deficiencies. Because celiac disease damages the small intestine, it can prevent your body from properly absorbing nutrients like iron, calcium, and vitamin D. This can lead to anemia, osteoporosis, and even unexplained weight loss. Over time, these deficiencies can cause serious long-term health problems. And for kids, celiac disease can show up in different ways. Instead of obvious stomach pain, children might experience slow growth, delayed puberty, irritability, or even behavioral issues. If your child isn't growing as expected or is struggling with unexplained mood swings, it's worth looking into gluten as a possible factor. As you can see, celiac disease and gluten sensitivity affect so much more than just digestion. That's why getting the right diagnosis is so important. Coming up next, let's talk about how doctors test for these conditions and why you shouldn't just go gluten-free before getting checked. So, you're experiencing symptoms and wondering, do I have celiac disease or gluten sensitivity? The only way to know for sure is through proper testing. Let's go over how doctors diagnose these conditions, because just cutting out gluten on your own could actually make it harder to get answers. First up, blood tests. Doctors start by checking for celiac-related antibodies, specifically tissue transglutaminase, TTG-IgA, and endomysial antibodies, EMA. If these levels are high, it's a strong sign that your immune system is reacting to gluten. But here's the catch. These tests only work if you're still eating gluten. If you've already gone gluten-free, the results might not be accurate. Another option is genetic testing. People with celiac disease almost always have certain genetic markers, HLA-DQ2 and HLA-DQ8. If you don't have these genes, celiac disease is extremely unlikely. But if you do have them, it doesn't automatically mean you will get celiac disease. It just means you're at higher risk. The gold standard for diagnosing celiac disease is an endoscopy with a biopsy. This is where a doctor uses a tiny camera to look inside your small intestine and take a tissue sample. If celiac disease is present, they'll see damage to the intestinal lining, specifically flattened villi, which are the tiny structures that help absorb nutrients. Now, what if your tests come back negative for celiac disease, but you still feel terrible after eating gluten? That's where an elimination diet comes in. To diagnose gluten sensitivity, doctors often recommend removing gluten from your diet for a few weeks, then slowly reintroducing it to see if symptoms return. Unlike celiac disease, there's no blood test or biopsy for gluten sensitivity. It's all about how your body reacts. So now that we know how to get a proper diagnosis, let's talk about what comes next: treatment. Because whether you have celiac disease or gluten sensitivity, the key to feeling better starts with what's on your plate. So, you've been diagnosed. Now what? When it comes to celiac disease, there's only one treatment: a strict, lifelong gluten-free diet. That means completely avoiding wheat, barley, and rye. Even tiny amounts of gluten, like crumbs from a shared toaster, can trigger an immune response and damage your intestines. But here's where it gets tricky. Gluten hides in places you wouldn't expect. Many sauces, salad dressings, processed foods, and even some medications contain gluten. That's why reading labels and being extra cautious when eating out is so important. If you've had celiac disease for a while, your gut may need time to heal. That's where nutrition comes in. Many people with celiac disease have deficiencies in iron, B12, and vitamin D due to years of poor absorption. Taking supplements and eating a nutrient-rich diet can help your body recover faster. Working with a dietitian can make a huge difference. A gluten-free diet isn't just about avoiding bread and pasta. It's about making sure you're still getting all the nutrients you need. A dietitian can help you create a balanced meal plan and avoid common pitfalls. Now, what about gluten sensitivity? The good news is, it's not as strict. Some people with gluten sensitivity can tolerate small amounts without major issues, while others feel best avoiding it completely. It's all about listening to your body and figuring out what works for you. The bottom line? Whether you have celiac disease or gluten sensitivity, managing your diet is the key to feeling better. And trust me, with so many gluten-free options available today, you won't have to miss out on delicious food. So, to wrap things up, celiac disease is an autoimmune disorder that requires strict gluten avoidance, while gluten sensitivity causes similar symptoms without the intestinal damage. If you're experiencing digestive issues, fatigue, or other unexplained symptoms, don't ignore them. Talk to your doctor and get tested before making any diet changes. Remember, knowledge is power. The sooner you get the right diagnosis, the sooner you can start feeling better. And if you found this video helpful, don't forget to like and subscribe for more health content. Let me know in the comments. Have you ever struggled with gluten-related symptoms? I'd love to hear your experience.